Today, my group and I will educate you on the medication oxycodone. I'm Micah and I will give you an overview of oxycodone. Michelle will describe the pharmacokinetics of the drug. Piper will define the affinity, mechanism of drug action, and efficacy. Natasha will describe the interdisciplinary team, and Yana will discuss the counseling and considerations for a patient prescribed with oxycodone. Oxycodone is a semisynthetic opioid with multiple actions qualitatively similar to those of morphine. It is in a class of medications called opiate narcotic analgesics, and it works by changing the way the brain and the nervous system respond to pain. Oxycodone belongs to poison schedule 8, which is a controlled drug, meaning the risk of drug dependence is high. This is only dispensed with a valid prescription from a physician. This pain relief is used to treat moderate to severe pain in adults. It can be used short-term or long-term depending on the individual's condition. Oxycodone is one of many drugs listed on the PBS, meaning all Australian residents who hold a current Medicare card are eligible to receive the subsidised price. Although the usual healthy adult dose is 5 mg every 6 hours, the dose may be reduced for individuals with hepatic and renal impairment. This is recommended to be taken after meal or with milk. Oxycodone is normally administered orally by tablets, or it may also be administered subcutaneously, intravenously, and per rectal. A study by the University of Queensland, Australia, shows very little difference in effect based on the different routes of administration.
Oxycodone has excellent oral bioavailability because it retains half its analgesic activity through oral administration. The bioavailability via oral administration averages a range of 60 to 87%. When orally administered, it travels through the gastrointestinal system. It crosses cell membranes of the intestine to get into the portal circulation. It then enters the liver and enters the systemic circulation. Metabolism is the process of biotransformation by which drugs are broken down so they can be removed by the body. Oxycodone metabolism primarily takes place in the liver, which produces the enzymes CYP3A4 and CYP2D6 for this purpose. These enzymes stimulate two forms of metabolism, the first being phase 1 metabolism, which subjects the drug to hydrolysis and oxidation, and phase 2 is when the drug joins with water-like substances. This process ends when the molecules have become hydrophilic enough to then allow them to be excreted by the body. Metabolism ultimately is intended to make the drug hydrophilic so it can be excreted via the kidneys and through the urine. Around 72% of an oxycodone dose is excreted in the urine, 8% as oxycodone, 47% as oxidative metabolites, and 18% as lowered metabolites. With oxycodone's half-life being anywhere between 3.5 to 5.5 hours, the medication will usually be removed from the body within 20 hours. The elimination process can be influenced by many factors depending on each individual. Some of these factors may include kidney and liver function, metabolic rate, body weight, and how often the individual takes the drug. Therefore, clinicians must understand the ways that oxycodone is metabolized and be able to identify the patient's characteristics that are likely to influence metabolism.
Oxycodone affinity and mechanism of drug action. Oxycodone is an opioid agonist with affinity for delta, kappa, and mu receptors in the central nervous system. Oxycodone has the highest affinity for the mu receptors and a lower affinity for the delta and kappa receptors. Oxycodone achieves its intended therapeutic effect of analgesia by acting on these receptors in the central nervous system, which in turn results in decreased activity of pain signals and the regulation of descending pain pathways from the brain. Oxycodone efficacy. The binding of oxycodone with the opioid receptors following intake results in pain relief and a somnolent effect. Oxycodone can produce many unintended effects as it impacts not only on the central nervous system, but also the cardiovascular system and on smooth muscle. These are listed in this table. Central nervous system effects include that it prevents coughing, reduces anxiety, constricts pupils, respiratory depression, and drowsiness. Cardiovascular effects include histamine release and vasodilation. Smooth muscle effects include constipation and decreased gastrointestinal secretions. Other effects may include nausea, dizziness, confusion, mood changes, sweating, flushing, and itching. With oral intake of medications containing oxycodone, for example endone, the therapeutic outcome of analgesia is usually experienced after 10 to 15 minutes. The peak concentration is usually achieved 30 to 60 minutes following administration. The analgesia usually lasts around 3 to 6 hours, but may be more or less depending on the medication containing the oxycodone, the dosage, type of release, and the individual's tolerance to the medication or drug.
Interdisciplinary team and drug scheduling regarding oxycodone. What schedule is oxycodone? Oxycodone is classed under Schedule 8. Schedule 8 drugs are considered to be drugs of dependence. S8 drugs are prescription-only medication that have a recognized therapeutic need but also have a higher risk for addiction, abuse, and misuse. What is an interdisciplinary team? An interdisciplinary healthcare team refers to a group of healthcare professionals from different disciplines working toward the same goal to provide the best care and outcome to a patient or group of patients. The purpose of having an interdisciplinary team is to foster frequent, controlled, and recognized communication among disciplines to create, arrange, and accomplish treatment goals. Who is involved in an interdisciplinary team? An interdisciplinary team involves many people. These include doctors, nurses, dietitians, pharmacists, social workers, physiotherapists, psychologists, and occupational therapists. All of these healthcare professionals are involved to work together with the patient, undergo assessments and diagnosis, and together they intervene, set goals, and create a care plan. During this process, the patient, their family, and carers are included in any discussions regarding their condition. Interdisciplinary teams and oxycodone. Oxycodone is an opiate analgesic and is a prescription-only medication. Oxycodone can only be prescribed by a doctor and can only be filled by a pharmacist provided the patient has a valid script. Within a hospital setting, doctors and nurses can administer oxycodone. If a patient is struggling with the effects of oxycodone, they can speak to a social worker, a psychologist, or a healthcare professional. Here are some multiple choice questions. Number 1. What schedule is oxycodone? Schedule 2, Schedule 6, Schedule 8, or Schedule 4? And question 2, true or false? A nurse can prescribe oxycodone. A for true, B for false.
We will now discuss counselling considerations for oxycodone. The common brand name for oxycodone is endone, OxyContin, and Oxynorm. Some common side effects include nausea, vomiting, constipation, drowsiness, and more. It's important that the patient understands these side effects when being prescribed or taking oxycodone. There are 3 considerations to discuss with our patient when being prescribed oxycodone. One is that it is an opiate and it can produce drug dependency if it's used long term. It's important that the patient is careful to take it exactly as prescribed and to speak to their doctor regularly about their pain. The second is that opiates cause constipation. It may be necessary to take a bowel prophylaxis, such as Movicol, or for the patient to increase fibre intake in their diet whilst taking oxycodone. The third is that oxycodone can increase the effects of alcohol and may make the patient feel tired or drowsy. It's important that they do not drive or operate heavy machinery if this is the case. It's also best to avoid alcohol when taking it. When a patient is prescribed oxycodone, it would be appropriate to refer them to other members of the interdisciplinary team, such as social workers, counsellors, speech pathologists, physios, OTs, and dietitians. A pain specialist possibly, if pain is continuing or a tolerance to the drug is developing. A pharmacist for a medication review, or a geriatrician if the patient is elderly.